two and a half. We're live.
All right, hello, everybody. It's Dr. Alex Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earle. And this is the time I get to spend with you guys answering all your plastic surgery questions, okay? You know it's coming from a reliable source because I am a double board certified plastic surgeon with over 10 years of experience, okay? Sorry about a little bit of the delay here today. We had a busy day in the OR, which is great news. It did some great cases today. Did 2 BBLs, a tummy tuck, and a mommy makeover. So an awesome day in the OR. And that's the great news. The downside is I didn't have time to prepare, so it's empty here today. So today we're gonna kick it old school, which I think what a lot of you guys like anyway. So today we're gonna kick it old school, and we're just gonna go ahead and answer a bunch of questions, okay? But before we get into that, a couple reminders. Number one, remember, if you're thinking about surgery with us here at Pure Plastic Surgery with myself or Dr. Vidal or Dr. Weigeriff, prices are gonna go up January 1st, so time is running out. Today is what, December 14th, right?
Yes, sir.
Today is December 14th.
13th,
sorry. And so, not a lot of days left, okay? Now's the time. And also, a quick reminder, all deposits are refundable, so it's really nothing to lose. So why pay more in 2024 when you can, set that price or lock in that price right now, okay? Another quick reminder, next week, for those that have been following me for years and years and years, you know that at the end of the year, every single year, I do our BBL stats, okay? So I've been doing this for multiple years now. I don't know of any other surgeon out there that does this, but I give you the real deal, the raw deal. I tell you how many BBLs were done. I tell you the complication rates. I tell you about revision rates. I tell you about all that stuff, okay? So if you've been following me, you know that I do this every single year. If you're new, well, that's something that we like to do to wrap up the year, to give you all our stats regarding our BBL cases here at Pure Plastic Surgery. So make sure you tune in to the next Hump Day, which is going to be exactly a week from today. All right? Okay, enough of that. Let's get into some questions.
Doc, before that,
yes,
where they can, because 3 questions the same, how they can book a consultation.
Okay, all right.
The 3 first questions.
3 first questions, awesome. So, so that part is the easiest way to do that is to go to the website. So that's www.pureplasticsurgery.com. There we go. www.pureplasticsurgery.com. And once you get in there, you're gonna see a button that says virtual consult or virtual consultation, okay? That's gonna be right on the landing page to the website. So we recommend going to the website, hitting that button, okay? And that's gonna ask you to fill out some information, fill out a questionnaire, send a few photos. Once you do that, that's gonna get to our coordinators. Then our coordinator will reach out to you and she'll answer all your questions and get you all organized, okay? We typically get a couple questions with this. One is, what if I want more than one procedure? The form is not letting me fill out more than one procedure. Don't worry about it. Just fill out the one procedure. When the coordinator reaches out to you, she can get everything in order. So just don't worry about that. The whole point is really to get your information, get your photos, so the coordinator can then reach out to you, and then she can take it from there. Okay? All right.
What's the ideal age for a BBL?
So the ideal, I don't know what would be the most ideal age, but I think the ideal age is actually typically for a little bit of a younger patient. I would say someone between, say, their mid-20s to their mid-30s, okay? But what is our age range? Our age range for BBL is between 18 and 50 years old. That is a range for BBL for me. There are other surgeons, including Dr. Vidal and Dr. Weigeriff, which probably go up to about 55 years old. But that's going to be their age range for myself. So between 18 and 50 years old.
Okay. All right, Dr. Earle. So I had my mommy makeover done in June 1st.
Yeah.
Just found out that I'm pregnant.
Oh boy.
Will I need to come back?
So it's possible, definitely possible, right? So just for information say, so mommy makeover is typically a combination of a breast surgery and a tummy tuck, okay? And ideally, when you wouldn't, get pregnant again after having your tummy tuck. So, I tell most of our patients, if you think you're gonna get pregnant again, if it's possible you're gonna get pregnant again, wait until you're done with having kids until you get your tummy tuck. So, of course, life always doesn't come out as planned, right? So you already did your mommy makeover, and now you're gonna be pregnant. Your body will go through some changes once again, both in the breast and the tummy area, right? So in the tummy area, things are gonna get stretched out again, so that skin's gonna get stretched out again, and the muscles may potentially separate again or become weakened again, okay? In the breast, because the breasts are gonna go through many changes due to the changes in the hormones, they may, get larger and then, come down again after breastfeeding, and that may cause the breast to droop again and have what we call sometimes a waterfall deformity, where the breast kind of falls below the implant, and the implant's still sitting nice where it's supposed to be, and the breast falls below that, in which case you would need to have a redo lift. So it is a possibility. I'm not saying that's going to happen for sure, but it is possible that we may have to do a redo on the lift and another tummy tuck if you get pregnant after your mommy makeover.
My BMI is 20, so it's possible for me to get a skinny BBL on TikTok.
Yeah, all right. Yeah, by the way, hello TikTok, everybody up there. I'm so glad you guys are into these lives and enjoying these lives. And just a reminder, we do this every single Wednesday, okay, on Hump Day with Dr. Alex Earle. Yes, so if your BMI is 20, then you would qualify for what in general terms is called the skinny BBL, but what we have here at Pure, which is our signature skinny BBL, which is our South Beach butt lift, or SO BBL. So that is for patients that have a BMI between 20 and about 24. So you would very likely be a good candidate for that. But in order to be sure, we would have to, get some more information. So go ahead and fill out that virtual consultation, and that way I can look at your photos and make sure that you're a good candidate.
Can you do Avali and second lipo BBL at the same time? Round 2?
Yeah, so round 2 BBL and ovally, can we do that at the same time? So it really depends on how many dimples we're talking about and the location of the dimples, okay? So what I don't want to do is a lot of fat transfer into an area where I'm also doing the ovally, okay? So if you have, for example, few defined dimples in the buttock area, then yes, I can probably release those dimples and do the fat transfer. And because I always use the ultrasound for the fat transfer, I can make sure that I'm transferring the fat in that deeper subcutaneous space, and the ovally, of course, that happens in the more superficial subcutaneous space. So we can definitely kind of combine those two. Also, of course, if we're doing ovally in other areas, such as the thighs, we can also combine that as well. However, what I don't want to do is, someone who has multiple, dimples, cellulite dimples throughout the buttock, and then doing fat transfer on top of that, because then that could potentially lead to what are called little blowout deformities, where you go from like a little indentation to a little pop out, which is not good and very, very difficult to fix.
Coming in January for my mommy makeover, do you think IV therapy or cold plunge would be beneficial to help prep for surgery? If not, what else would be beneficial for surgery?
Yeah, so you're coming for your mommy makeover, which is great. And at least if you're coming to us, you are going to get a call somewhere around 45 or so days before surgery, and we are going to give you a lot of instructions as to what to do and what not to do. We're also going to make sure that you start on your vitamin C, your folic acid, and your iron supplementation. Okay. Most patients don't need any sort of IV therapy before surgery. In terms of cold plunge, I don't know that has a particular effect before surgery one way or another. I think just in general it has healthy effects, and so a lot of people are talking about that. I haven't tried it out myself, but it is something actually that I'm quite considering, because it's supposed to have a lot of benefits in terms of your hormone status, and basically by bringing down what we call the catecholamines, the things that make you like anxious or nervous. So it kind of brings those down, which is beneficial. And so it has a lot of things that could actually help just for your health in general, but it's not something that I would ask my patients to do particularly for surgery.
Can you remove as much fat with Vaser as with traditional lipo?
So I think with the Vaser, you could actually remove more fat. Okay. So let me just explain this a little bit. When you do the Vaser liposuction, it's like you're adding a step, right? It's not instead of. So when you do Vaser, it's like you're adding the step of the Vaser, but you're still doing your power assisted liposuction. Okay. So the Vaser, what that does is that it uses an ultrasound energy. It's different than ultrasound imaging. I know it's confusing, I get it, but it's not the same thing, right? Ultrasound imaging is what I use when I do the fat transfer. That's what allows me to see the cannula underneath the skin. Now, ultrasound energy is actually vibratory energy, okay, that allows the fat cells to basically dislodge, a technical term called emulsify, but basically they dislodge and therefore becomes easier to then remove the fat cells with the liposuction. So when you do the Vaser, you have more fat removal, and it's done in a way where there's less blood loss and less inflammation. And on top of that, because that energy imparts a certain degree of heat to the skin, you have better skin retraction. So it's a great, great tool. I've been using it. I started using it this year, and let me tell you, I love it. I absolutely love it. And I'm thinking about potentially making it mandatory for next year because it's just such a great tool that everyone should get this.
Can you reshape a BBL?
Yeah. So that's a great question, and it's a question that's becoming more and more popular. It became more and more popular in 2023, and I'm sure it's just going to continue to grow in 2024. Why? Because back a few years ago, say between 5 to 10 years ago, BBLs were being done in a way where people weren't really caring about the underlying foundation. They really weren't caring about shape, and it was all about just about volume, right? And creating like these shelves and these lats and these very surgical kind of quote unquote fake looks, if you will, or surgical looks. And sometimes they wouldn't even match the body. Like, the thighs would be thin and you have this huge BBL and things wouldn't match. So nowadays, that's not the case. Nowadays, people want to reshape their BBLs. They want to reduce some of the volume. They want less lats. They want more hips. They don't want that big shelf. They want more of a slope, even it could be a pokey slope, but more of a slope. So we can definitely reshape a BBL. And we're actually very well known here at Pure Plastic Surgery for BBL, BBL revisions, BBL reshaping, or BBL reductions or reversals. Any of those terms are, basically compatible. But bottom line is, if you had a BBL, you want to have a better shape, one that fits your body, your underlying foundation. Perhaps you want to have a little bit less volume in certain areas. We can certainly do that for you, but we need to do an evaluation first, okay? So make sure you go and send those photos.
Oh yeah, this is a patient that did the same question on YouTube and also on TikTok. And she said that you recommend to her to get Vaser for her skinny BBL.
Yeah.
But at YouTube, you said that Vaser kills fat cells.
Yes, so that's right, and but check out the timing of those two things, right? I told you recently that we should do the Vaser, and that other video is probably more than a year old, okay? So why the difference, all right? Because, and it's true, for a long time, I was not using the Vaser because most of my lipo cases were with fat transfer, and at that time, the Vaser was not preserving the fat cells. But, like everything, right? Like you go from iPhone 2 to iPhone 15, right? Like all technology, the Vaser technology has gotten to a point where it can do everything that it needs to do and preserve the fat cells as long as you have it in the correct settings, which now you can do, okay? So now, and there's been multiple studies that show that there is fat cell viability now, and so with this latest machine, which we have here at Pure Plastic Surgery, we just bought it a few months ago this year, so it's the latest version, okay? With that machine, we are able to do this and preserve the fat cells and have great fat cell retention when we do the fat transfer. So I so highly recommend it. But the settings that I use are the ones that are, that preserve the fat cells. If I were to take our machine and crank it as high as it can go, then I would probably be killing fat cells, right? So you have to have the experience, you have to have the knowledge, you have to know exactly how to use the machine in order to get all the benefits from it.
She said, "Thank you for answering, Dr. Earle."
All right, you got it.
I hope to see her back. Let's see. Okay, breast lift and BBL can be done together.
So I typically do not combine those procedures, okay? Especially because I'm here in Florida, as you all know, we're here in Miami. And so Florida has specific rules that are, given to us by the Department of Health. And so one of the rules is that when you do a surgery where you're making large incisions, such as a breast lift, then we're limited to how much fat we can remove via liposuction, which is only 1,000 cc's. For most patients, removing 1,000 cc's does not make a huge difference in their shape, or adding, only 1,000 cc's, maybe 500 per side, does not make a big difference to their hip or their buttocks, and therefore you're not really getting the most out of your BBL. Okay. And then the other thing is recovery. I like all of my BBL patients to recover by sleeping face down. Okay. That way we can really relieve all the pressure to the buttock and hip area. Of course, if you do a breast surgery, then you should not be laying on the breast, right? So then one of the recoveries is going to suffer. Either you lay on your breast and then your breast is going to suffer, or you then lay on your back. Even you try to find like a cutout, you try to find a special mattress, a special pillow, etc., etc. But that recovery is going to suffer. You're probably going to lose more fat than you would otherwise when you're already starting with less fat to put in the first place, because we're limited as to how much fat we can come out, right? So it just doesn't make any sense. If you want to have the best, the most bang for your buck, you want to have your best breast results and your best BBL results, it's better to separate these two surgeries.
With a tummy tuck, do you lipo the front at all too?
So we focus the lipo to the flank and the waist area, okay? And we don't lipo in that central front abdominal area. Why is that? Okay, again, for a couple of reasons. One, we just talked about the limits, right? We're limited to only 1,000 cc's, and most patients have 1,000 cc's in their flanks and their waist, and I want to lipo those areas to bring out that curvy shape or that curvy figure. All right, as you can see, a lot of our tummy tucks, they still, they come out with that very beautiful hourglass shape, as opposed to many of the tummy tucks you may see elsewhere, where the patient's still very square, right? We want to avoid that. The other thing is, when you do a tummy tuck, especially a full tummy tuck, you're dissecting or you're lifting up the skin and the fat all the way up to the xiphoid, which is here, from here all the way down, right? So you're lifting all that up. So you're, by definition, reducing some of the blood supply to that skin, okay? And then if you then do that and then you lipo that area, it's like a double insult. You did the lifting and you lipoed it. Now you have a double insult that may lead to problems with what we call skin necrosis or skin dying, okay, or the wound's not healing well. All right, so it's typically not a good idea. I'm a little bit more conservative on that side, so I won't lipo that area. But I always recommend doing your tummy tuck first. You can come do your tummy tuck, then 3 to 4 months later, we can do your lipo 360, and at that point in time, we can certainly address that area and kind of just bring it all together.
How to prevent capsule contraction after surgery in the post-op?
Yeah, so unfortunately, there's not like any surefire way of preventing capsular contracture, okay? In fact, it's not even really completely understood. We don't know exactly why some patients develop capsular contracture and others don't. We don't even know why a patient should develop capsular contracture on one side and not the other, right? It's the same patient, the same implant, the same surgeon, yet it happens on one side and not the other. So we don't really understand the mechanism of it. There are some theories out there. Some people say maybe there was a little bit more blood, more blood on one side, or maybe there was a little bit more bacteria on one side. We're not really sure. So is there a surefire way to prevent capsular contracture? There is not. But we do a few things to try to minimize that risk, okay? One is we wash the pockets with antibiotic solutions, betadine and antibiotic solutions to try to minimize any risk of infection or bacteria being present. We use a funnel no-touch technique. That also helps reduce the risk. We put the implants in either a submuscular or subfascial plane. That also reduces the risk as compared to a subglandular plane, okay? And we put our patients on antibiotics for at least 1 week. So we started the day of surgery to 1 week of oral antibiotics, again, to try to reduce the risk, okay? But unfortunately, the risk is never zero, and it can happen. Another thing that we can do is to have the patient start doing breast massage at 2 weeks post-op, and that could also help some as well.
After you leave your butt with a BBL, does it eventually drop again?
So if you have a BBL where your butt eventually drop again, I mean, eventually everything drops, right? But it should last you a long, long time. What I mean by that is that once the fat, takes and it lives, that's your new shape. And you can maintain that shape for years and years and years if you have your adequate nutrition and exercise program, okay? So, a BBL, it's a great surgery, a very powerful surgery, but you do have to maintain it, right? So the best combination is all three, which is your surgery, your nutrition, and your exercise. If you drop any one of those, your shape's gonna suffer. So the best thing is to keep all three, and if you do that, you can keep that new shape, that new BBL for many, many, many years. Now, of course, as you start to get older, you start hitting your 60s, your 70s, your 80s, the skin is not what it used to be, right? And you are gonna lose that skin elasticity, that ability to bounce back, and things are gonna drop, and they're gonna drop, like they drop anywhere for our older folks, right? They're gonna drop in the face, they're gonna drop in the belly, they're gonna drop in the buttocks, etc.
Would you recommend a BBL or a mommy makeover first?
So if you're gonna do both, I always recommend the mommy makeover first, okay? Or if it's just not a complete mommy makeover, it's just a tummy tuck, I always, always, always recommend the tummy tuck first, okay? You wanna do the tummy tuck first because you wanna remove all that excess skin, and you wanna fix that muscle, you wanna do that muscle repair, you wanna tighten up that abdominal wall, okay? And that's gonna make your BBL result a whole lot better, okay? If you do it the other way around, I mean, it's possible, you can do it that way, but a lot of times what I see is that the people are just they're not having the BBL to start because their belly's not flat, they still have all this loose skin in that lower belly area, which is not flat either, it looks lumpy, bumpy, or wavy. And the reason for that unevenness is because of the loose skin, okay? And then because you've done the liposuction areas, you now have scar tissue and inflammation, so the skin doesn't stretch down as much, it's tougher to remove the skin, okay? And you may end up, with areas of, scar tissue already, okay? So it's not the best way to do it. I always recommend doing your mommy makeover or your tummy tuck first, and then come back 3 to 4 months later to do your BBL.
Who qualifies for a mini tummy tuck?
Great question. So mini tummy tucks can be done, but few people qualify for that. Not everyone qualifies for a mini tummy tuck. Why is that? What's the difference? So the difference between a mini tummy tuck and a full tummy tuck is not just about length of incision, okay? So yes, a full tummy tuck may have an incision that's gonna be a bit longer, but the mini tummy tuck incision is still longer than your typical C-section scar, okay? But the main differences are that with a mini tummy tuck, you are simply removing the excess skin that's between the belly button and the pubic area, and that's it. With the full tummy tuck, you're removing all the excess skin in the abdominal area, you're doing the umbilical transposition, which means there's gonna be a little scar around the belly button, and you're doing that muscle repair, okay? So, who qualifies for a mini tummy tuck? It is those people that they don't have muscle separation, they don't have abdominal wall weakness, they don't have loose skin in the upper abdominal area, they only have a bit of loose skin in the lower abdominal area. And those are going to be the candidates for the mini tummy tuck.
I just had a BBL 5 weeks ago and my stomach is still so swollen.
Yeah.
Is that a normal thing?
Yeah, it's not unusual. So after 5 weeks, you can still have quite a significant amount of swelling. I always tell my patients that you really shouldn't expect the swelling to go away for a minimum of 3 months. though it could be easily up to 6 months. Okay?
What's the average amount of time a patient spends in the OR for a mommy makeover?
So that's going to depend on the surgeon, all right? But, surgeons that do this all day, surgeons like myself, really, efficient surgeon does this day in, day out. We're actually, we're quite fast. So for me, a mommy makeover, and let me just say, like our typical mommy makeover, which is a breast lift, implant, tummy tuck with muscle repair and liposuction to the flanks, I could usually get that done in about 2.5 hours. Okay. Now there may be other surgeons out there that are, not as efficient. It could take them almost twice the time, like 5 hours. All right, but here at pre-plastic surgery, I do everything I can to be as efficient as possible. Your safety is my primary concern. Part of that is not keeping you in the OR table in the general anesthesia for a very long time. I try to minimize that time as much as I can, and so we do things in a way which is very, very efficient, and we're able to get it done more quickly, and like I said, typically 2.5 hours for a mommy makeover.
Can you do lipo on someone with an hernia?
So you have to be very careful with that, okay? If it's a small umbilical hernia, then then that's typically it's okay to do that because you can avoid the area, okay? But if you have a large hernia, whether it's in the belly button or anywhere in the abdominal area, what we call a ventral hernia, you really shouldn't do lipo there because it can be dangerous, okay? Because the hernia means that the bowel, the intestine, the things that are inside the belly are popping up through that abdominal wall. And if it's popped up and you hit that with your liposuction cannula, that's going to be a disaster. Meaning, hospitalization, intensive care unit, potentially even death. Okay? So, if you have any sort of significant hernia, it is best to go ahead and repair that hernia first. Make sure that that abdominal wall has been repaired, that nothing is kind of sticking out of it, and then go ahead and do your liposuction.
Do you think 48 is too old to get a mommy makeover?
No, not at all. I think that's a great age to get a mommy makeover, actually. And so, and with the mommy makeover, I said for BBL, my age range was 18 to 50. For my makeover, I think it's actually higher. You can go all the way up to 55 easily, perhaps a little bit more if you're completely healthy. But 48 is a very, very good age for your mommy makeover.
I had a tummy tuck and I still have loose skin under my belly button. Do you recommend a revision?
So I would really have to see you and see exactly what's going on, right? Okay. If it's very, very loose, then yes, you may need a revision, and perhaps because you've had your tummy tuck already, and perhaps you've already had your muscle repair, then maybe at that point in time you just need like a mini tummy tuck where you're just addressing the skin below the belly button. Now, if it's something that's quite mild, then sometimes that can be fixed with something external like Morpheus 8, where we do microneedling with radio frequency, and that can help that area, okay? Or maybe some body type, which is if it's more like mild to moderate, okay? So I think there are a few options depending on the severity of the skin laxity after your tummy tuck.
How long do you have to wait for a tummy tuck and lift after gastric bypass?
Okay, that's a good question. And let me expand that question as well, because now people, yes, they're doing the bariatric surgery to lose weight still, right? So your gastric bypass, gastric sleeve, things like that. But also people are also using the new weight loss medications, okay? Your Ozempic and Mounjaro as well, okay? And so they fall into similar categories in the sense that you want to wait until your weight is until your weight is stable before undergoing your surgery, right? So if you're still in that downward phase, you shouldn't do surgery there, right? Because it doesn't make any sense to do surgery and then lose another 20 pounds or so, okay? Because things are just going to get all loose once again. So you want to make sure that you're coming down and that you've then kind of plateaued and you're at a stable weight, a weight that you're happy with, all right, after your bypass sleeve or even your Ozempic or Mounjaro. And when you're at that happy kind of stable weight, then you can do your procedures. It typically takes at least 6 months.
And the last one, Dr. Earle.
That's it?
Yeah, 30 minutes.
What?
So we're over time.
Oh boy.
But
All right.
what's the most dangerous part of getting a BBL?
All right. So traditionally, okay, the most dangerous part of getting a BBL was the actual fat transfer because it was being done in a way where people were injecting fat into or deep to the muscle, whether they knew they were doing it or not. Okay, and when you do that, you can injure these large vessels called the superior and inferior gluteal veins, and if fat gets in there, you get something called a fat embolism, which can then go to the lungs and be potentially fatal. And that's why BBL had gotten, and still does to today, all this bad press. However, that is not the state of the BBL today, 2023, almost 2024, okay? The mortality rate, which used to be about 1 in 3,000, is now at least 1 in 15,000, excuse me, if not even less so, okay? The way that I do a BBL, and that I've been doing it since 2019, one of the pioneers in this technique, is that I use ultrasound imaging to guide me when I'm doing the fat transfer. That means that I've turned a blind procedure into one where I can see. And I know exactly where my cannula is and that I'm placing it in that safe space that's between the skin and the gluteal muscle. And if you're in that safe space, you're not going to injure any vessels because the vessels don't live there. Okay, and the incidence or the chance of having a fat embolism is very, very low. Okay, so we just actually got a study accepted by the biggest journal in terms of aesthetic surgery, okay, and where we've demonstrated our experience, and we've done about 2,000 ultrasound guided BBLs with 0 incidence of fat embolism and 0 mortality, okay? So that is no longer the case. Now it's, if you go to someone like us that has a ton of experience with these procedures and that uses ultrasound to do the procedure, the complication rate is like basically the same as any liposuction case. And it's not any more dangerous than that. Okay? All right, so I hope that answered that question. But if you want to know our stats, tune in next week, okay? So we're going to be doing Hump Day next week. Let's do the same time, 4:30 p.m. Okay, 4:30 p.m. next Wednesday, Hump Day with Dr. Alex Earle. And we're going to go over all of our BBL stats for the year, okay? All right, in the meantime, remember, if you want an evaluation, you know where to go. All right, and if you're on the fence about putting in your deposit for that quote, now's the time, because it's only going to get more expensive in 2024. All right, everybody. Well, I like the old school,
Yeah, we should do this often.
We get a lot of questions in, so that's great.
I have like 20 more.
So yeah. So I think we're gonna kick it old school, I think, more often now, so we can get even more questions in. All right, guys. All right. Well, this has been great. I look forward to seeing all of you next week on Hump Day, Dr. Alex Earle. Ciao. Ciao. Ciao.
Great.